I think it's important for patients to understand their options. In order to really understand them, they need to be educated to some point on implants and the dental prosthesis connected to them. On a daily basis, I'm trying to help patients understand the complex situations by organizing and simplifying it and telling them in plain terms how it will affect them. Traditional or conventional dentures, as we sometimes say, are just plain dentures, not connected to implants. And they have many problems. The chewability or function of dentures is very poor. The best dentures on the upper jaw, as long as it completely covers the palate to get better stability and suction and surface area, can get about 40% chewability. And that's the best. One of the biggest complaints about dentures, besides chewing function, and the instability and lack of retention, is that the upper denture covers the palate. And basically, people hate that because the feeling of food on the palate enhances the pleasure of eating. And when you cover the palate with an acrylic plate and can no longer feel it, the enjoyment of eating decreases immensely. At Reynolds Oral and Facial Surgery, we do not strive to be the cheapest, we don't strive to be the quickest, we strive to give patients value. My goal is to give patients the highest quality implants and dental prosthesis at a reasonable price that is going to be beautiful, have excellent function, and be long-lasting. All-on-4 concept attempts to get a full set of teeth with only 4 implants so that you have a minimal amount of complexity. The thing is, we are with you the whole way. We see you through not only the surgery but afterwards to ensure your prosthesis and your dental implants are going to last. Every patient is an individual, and I treat them that way. Every situation is slightly different. The first thing that I do is I listen to my patients. I want to know what they care about, what they need, and that's where we start. Next, I do a thorough evaluation, including their overall health, as well as an intraoral exam and an assessment of every tooth that's remaining in their mouth to see what its long-term prognosis is. I look at how much work is necessary to get the existing teeth in good shape and then make some treatment plans, starting with the ideal treatment plan. Sometimes we are considering the health of the patient and what might be best in their situation. Sometimes patients voice that financial concerns are very prominent, and so we look at some options to address that. If a patient has aesthetic concerns that are most important to them, then we can modify the treatment to make sure that that is the most important factor. In some cases, we are trying to work with existing teeth either in the same jaw or in the opposite jaw, which the prosthesis will have to bite against, and that might create some challenges. Then I create 3 treatment plans. First, the ideal plan, and then Plan B that might address some of the above concerns, and then Plan C. When you come to our office, we'll start with a little brief education on dental implants. Then you will meet with one of the assistants who will go over medical history and start documenting some of the important information. Then you will meet with me, and I will listen carefully to your desires, and then do an examination and an assessment of your dental situation. Don't let life pass you by. You deserve to take care of yourself, and the people around you deserve to have the best of you. You may be surprised to know how much the people in your lives want you to be happy and healthy, and in many cases, getting a good set of teeth is the answer to both of those wishes.